Greetings, everyone.
We're Anastrozole, and today we will be taking turns in sharing things about ourselves that you might find interesting.
Are you ready? Let's start this.
Our generic name is Anastrozole, and we belong to the variety of drugs that affect the reproductive system. You might know us through some of our brand names such as Aramedix, Aramed, Aramed1, Anarom, Strazole, Dualizole, and many more. Our chemical name is 1,3-benzene diacetonitrile. A lot of names, right? It's okay, you can just call us Anastrozole.
For my drug classifications, I belong to the therapeutic class called anti-neoplastic agents, which are medications used to treat cancer. For my pharmacology class, I belong to aromatase inhibitors, drugs that are used in treatment for breast cancer. Do you have any ideas of what I do now? Okay, let's continue. I belong to the pregnancy category X because I may be hazardous to the fetus. Anastrozole, which is me, is contraindicated in women who are pregnant or may become pregnant while taking the drug.
Now, for my mechanism of action, I inhibit the production of the hormone estrogen that are present in postmenopausal women who have hormone receptor positive breast cancer. It exerts anti-estrogenic effects through selective and competitive inhibition of the aromatase enzyme that converts adrenally produced androgens into estrogen. This enzyme is found predominantly in the adrenal glands, liver, and fatty tissue. Together with progesterone, the presence of the hormone estrogen stimulate and/or maintain the growth of the tumor in most breast cancers that are hormone receptor positive. Through the inhibition of the biosynthesis of estrogen at the enzymes, it lowers the estrogen level in the body and delay the growth or decrease the size of the tumor.
I am taken orally and is well absorbed into the systemic circulation with 83% to 85% of the radiolabel recovered in urine and feces. Under fasted conditions, the absorption is rapid and Tmax is typically reached within 2 hours. If you administered me 30 minutes after food intake, Cmax is decreased by 16% and Tmax is extended to 5 hours. Co-administration with food reduces the rate but not the overall extent of absorption. It is linear over the dose range of 1 to 20 milligrams and does not change with repeated dosing. For distribution, I am bounded to plasma proteins by 40% in the therapeutic range. Plasma concentrations approach a steady state level at about 7 days of daily dosing and is 3 to 4-fold steady state plasma levels higher than levels observed after a single dose of Arimidex.
I am metabolized in the liver. My metabolism occurs by N-dealkylation, hydroxylation, and glucocoronidation. These three metabolites are identified in human plasma and urine. Approximately 85% of my elimination is done through hepatic metabolism, and approximately 10% of the administered dosage is eliminated unchanged in the urine. My mean elimination half-life is 50 hours.
I am an adjunct therapy in the treatment of hormone receptor positive early breast cancer and first-line treatment for hormone receptor positive locally advanced or metastatic breast cancer in postmenopausal women. I can also be used in treatment of postmenopausal women who have advanced breast cancer that experience disease progression despite treatment with tamoxifen. I should not be taken by pregnant women or to those who become pregnant because I may cause fetal harm. I am also contraindicated to patients who show hypersensitivity reaction towards me. These reactions include anaphylaxis, angioedema, and urticaria.
Now, I will be talking about my side and adverse effects per body system. In the cardiovascular system, the heart may experience vasodilation, hypertension, sudden cardiac death, blood clot in veins, and insufficient blood supply to the brain. In the blood, there may be decrease in hemoglobin and white blood cells. For the lymphatic system, there may be swelling of lymph nodes. For the central nervous system, there may be fatigue and lack of energy, mood disturbances, headache, depression, sleeplessness, dizziness, fainting, abnormal sensations, anxiety, increased tightness of muscle, and slurred speech.
For the integumentary system, rashes, sweating, redness of the skin, pain, burning, or tingling in the hands and feet, mucous membrane infection, and hair thinning. For the ears and nose and throat, inflammation of pharynx, difficulty swallowing or breathing, persistent cough, and clouding of eye lenses. For the gastrointestinal, stomach disturbances, nausea, loss of appetite, vomiting, abdominal pain, constipation, diarrhea, indigestion, gastrointestinal disorder, and dry mouth. For the reproductive system, breast pain, UTI, inflammation of the vagina, breast neoplasm, vaginal bleeding, whitish or yellowish vaginal discharge, and vaginal dryness. For the liver, increased level of liver enzymes and jaundice. For the musculoskeletal system, inflammation of joints, joint and back pain, bone pain, increased risk of fracture, pelvic pain, and muscle pain.
These are the nursing responsibilities that should be observed before, during, and after administering me. Give drug under supervision of a prescriber experienced in use of anti-neoplastics. The nurse should note that patients with hormone receptor negative disease and patients who didn't respond to previous tamoxifen rarely respond to anastrozole. The nurse should note for patients with advanced breast cancer to continue anastrozole until tumor progresses. The nurse should monitor bone mineral density of the patient as drug can decrease bone mineral density.
The nurse should note that the use of drug is only for postmenopausal women. Remind patients not to take any medications containing estrogen while taking anastrozole. Inform patients that anastrozole may be taken with or without food. Inform patients of proper storage of the drug and assess client for any allergies. And that's it for us.
Wow, you probably know us well now.
Thank you for listening.
Bye.
Goodbye.